Hi everyone, I'm going to give you a quick walkthrough of the site and a demo of one of our chatbots and its capabilities here. If you're watching this video, you've come down to the Watch a Demo video link down here. Up in the top right, you'll see a sign up and login link. If you click that, it'll take you to the sign up screen first. If you've already created a membership, you can click the login button right here. If not, you can sign up either with your email or log in with Google or Facebook. Okay, once you've logged in, you'll see hello and your username, whatever you set it to, up in the top right. From there, you can go to your subscriptions, your profile, your account settings, any notifications, and you can log out as well. Just as a reminder, it's free to join the site, and if you do, you get access, as you can see down here, to a couple of different free chatbots, some of which are just for fun and entertaining, and some of which are pretty useful. And as a reminder as well, if you're HPSP, USIS, or any of the military programs in the US, you get access for free. And if you click this link up here, it'll walk you through how to do that. Hopefully you've already used our Limitless Medicine preview chatbot here, which gives you 5 free questions for any shelf exam topic. But today I'm going to walk you through a specific example. So this is the screen you'll see when you load up any of the chatbots. Each of the chatbots will have some instructions on them and examples of the type of things that you can type into the response box down here. Obviously, since it's AI, it uses just natural language, so you can type basically whatever you want into it, and the AI will work with you to make the exam questions and give explanations and that sort of thing. So here I'm just going to write go, and it will just start giving us random questions within the emergency medicine topic for shelf exams. Okay, so here it's given us a question about a 45-year-old male presenting with severe chest pain starting 30 minutes ago, described as crushing and radiating to his arm and jaw, diaphoretic, anxious, hypertension, hyperlipidemia in his past medical history, and you can see his vital signs there, tachycardic and hypertensive, a little hypoxic, with ST elevations in 2, 3, and AVF, and then is asking what the next best step is. So obviously in this one that qualifies as a STEMI, you'd call a STEMI and get him to the cath lab as quickly as possible. Okay, so it'll go ahead and explain why D is the correct answer and why A, B, and C are the incorrect answer. And then if you want, you can either ask more questions or you can just go on to the next question. Let's see what it comes up with next. Okay, so here it's given us a 32-year-old woman with sudden onset shortness of breath and paralytic chest pain, just returned from a long-haul flight 2 days ago, no past medical history, not on any medications, is tachycardic, tachypnic, hypoxic, normal blood pressure, and the chest x-ray is normal. So here it's asking us again what the next best step in management is. It's going to go with B. Which out of those choices is the correct answer, to work up for a pulmonary embolism with high suspicion. So let's ask it, why not get a D dimer first? And have it explain a little bit more. So as you can see here, it'll talk about pretest probability and the limits of D-dimer testing and what to do in that case. You can read this for yourself. Well, let's make the questions harder. See what it comes up with next. Okay, so it gives us a 60-year-old male with COPD presenting with shortness of breath, a productive cough, sputum production, wheezing, using accessory muscles, and appears cyanotic. It gives us his blood pressure, his heart rate, his respiratory rate, which is tachypnic and a little hypoxic, and then gives us an ABG to interpret there. What's the most appropriate initial management step for this patient? Well, since he's in respiratory distress, let's go with B. And that's going to be correct as well. Again, you can read that there. You can tell it harder. Let's do harder. See what it comes up with. All right, so a 55-year-old woman presenting to the emergency department with sudden onset, severe headache, nausea and vomiting, worst headache of her life, poorly controlled hypertension, is alert but in distress. You can see her blood pressure there, some neck stiffness. Non-contrast head CT shows no acute intracranial hemorrhage. What's the most appropriate next step in management? I'm going to intentionally answer wrong here just to show you what happens. Okay, so obviously the next best step would be a lumbar puncture in this case for test taking purposes for a subarachnoid hemorrhage. In this case, I answered B, and we'll give you an explanation as to why. Okay, so let's say you've gone through questions, you're done studying, and you want to stop. So you can just type stop or end or I'm done, whatever you want to indicate that you're stopped. And the chatbot is going to give you the total number of questions that you answered, how many are correct, and your percentage. It's going to give you some study recommendations. In this case, review the diagnostic approach for subarachnoid hemorrhage and continue practicing questions on some of the other topics. And then it's going to ask you, would you like me to generate Anki compatible flashcards based on your session? And if you indicate anything that's affirmative, it's going to go ahead and do that. So it's going to auto format these with a front, a back, and then 3 tags. And as you can see, these do go off the screen, so you will have to scroll a little bit to read all of them. And we won't go through all of these, but it will give you the chance to either edit or download the flashcards. So if you say download, it's going to generate a link that will allow you to download. Now this is an action on the back end, so it will take about 30 seconds to a minute depending on how many flashcards. And then as you can see, it'll give you a flashcard here. I'm going to make another video on how to download these flashcards and how to upload those into Anki in case you aren't aware. So look out for that video next.